Breaking news for seniors across the UK. Major changes to NHS general practice are on the horizon, set to take effect in May 2025. These aren't just minor tweaks, they represent a radical overhaul of how GPs operate, with a laser focus on personal care and streamlined services. If you're over 60, retired, or grappling with a chronic health issue, brace yourself for a transformation that could reshape your healthcare experience. We're diving straight into the details to understand how these changes will enhance your interactions with your doctor. At the forefront of this new initiative is a return to the family doctor model, which many regard as the gold standard in patient care. This model encourages patients, particularly seniors, to consistently see the same GP for all appointments. It may sound straightforward, but the ramifications are profound. When your doctor knows your medical history, understands your ongoing health conditions, and remembers your preferences, the quality of care significantly improves. You won't have to recount your entire health story at every visit. Instead, you'll cultivate a relationship with a healthcare provider who truly understands you, leading to more accurate diagnoses and effective treatments, not to mention a greater sense of trust. But that's just the beginning. The government is actively working to alleviate the administrative burdens that have long plagued GPS, cutting into the precious time they could spend with patients. For years, the system has been bogged down by paperwork, performance metrics, and bureaucratic red tape, limiting the time doctors can dedicate to you. These new reforms aim to slice through that clutter. By scrapping outdated performance targets and simplifying administrative processes, GPS will have more time to focus on what really matters, your health. Expect longer appointments and the ability to tackle multiple health issues in one visit, allowing you to receive the care you need without feeling rushed or ignored. To back up these sweeping changes, the government is committing an additional £889 million to bolster GP practices throughout the UK. This funding will be directed toward hiring more staff, upgrading medical equipment, and improving digital systems. It's not merely an investment in facilities and technology, it's a commitment to enhancing your experience as a patient. With more hands on deck and better resources, the goal is to make your visits smoother, more efficient, and far more comfortable. Another critical aspect of these reforms is empowering you as a patient. The NHS is shifting towards a model that emphasizes patient choice and autonomy. This means you'll have greater control over how and where you receive treatment. If there's an independent provider offering quicker service than your local NHS hospital, you'll have the option to choose that route instead. These new regulations are designed to make healthcare more convenient and tailored to your lifestyle, whether that means receiving treatment closer to home or selecting a specialist that suits your needs. In addition to expanding choices, the NHS is finally prioritizing patient collaboration. This means involving you in the design and delivery of healthcare services through improved communication with caregivers and those with long-term conditions. The system is being overhauled to reflect the actual needs of the individuals who use it. Imagine having the opportunity to voice your opinions on how care is organized, ensuring it aligns with your lifestyle and preferences. This is a people-first approach to healthcare that is finally becoming a reality. On the digital front, the NHS is doubling down on the use of the NHS app. If you haven't explored it yet, now is the time. This comprehensive digital tool allows you to access your medical records, book appointments, order prescriptions, and receive personalized health advice, all from the comfort of your home. For seniors already familiar with smartphones and tablets, this offers both convenience and independence. If you're new to digital tools, rest assured that support will be available to help you make the transition smoothly. This isn't about replacing traditional care, it's an additional option designed to save time and help you access services when it suits you best. One of the most pressing issues these reforms aim to tackle is the ongoing crisis in elective care waiting times. Currently, patients can face agonizing waits of over a year for essential procedures like hip replacements or cataract surgeries. This is simply unacceptable. The NHS is prioritizing a reduction in these waiting times by ramping up diagnostic capacity, enhancing surgical availability, and employing smarter scheduling systems. With more resources and a renewed focus on patient needs, the expectation is that delays will diminish, resulting in much more prompt care. These reforms also signify a cultural reset within the NHS. For too long, the focus has been on metrics and targets, often at the expense of patient experience. Now, patient experience is being elevated to equal status. Have you ever felt like just another number in the system? The NHS is actively working to eradicate that feeling. The new approach emphasizes treating patients as individuals, with dignity and respect, ensuring that you feel heard and supported throughout your healthcare journey. As we approach this new era of NHS care, engagement is crucial. This is not a passive change, It's one that demands your active participation. Start by discussing these reforms with your current GP. Ask how your practice is preparing for the upcoming changes. Familiarize yourself with the NHS app or seek assistance to get started. Most importantly, make your voice heard. Your feedback will play an essential role in shaping how these reforms develop. In conclusion, the NHS GP reforms coming in May 2025 are comprehensive and patient-centered. From revitalizing the family doctor model to alleviating administrative burdens, from investing nearly £900 million into GP practices to empowering patients, the intention is clear: to create a healthcare system that genuinely serves you. It's about ensuring continuity of care, reducing waiting times, leveraging technology intelligently, and fostering an environment where patients feel valued and respected. Now is the time to prepare. Engage with your GP, explore the NHS app, and stay proactive. The better informed you are, the more confidently you can navigate the evolving healthcare landscape.